explanation, maybe actually the numbers of what that is, say from like 200 up to 400 or something?
I
Or
think
just,
in terms of
you know,
numbers.
makes sense?
I just brought the percentages today. I don't have the numbers. I apologize.
No, that's fine.
Can we get those?
Yes. Other questions?
Has there been communication, coordination with other hospitals, who obviously provide some similar services? Or do you just do this on your own?
Oh, no. I mean, we participate in the State Trauma Advisory Committee, and we are, intimately involved with all of those in the area who can help. We routinely receive patients from Harvard and Walworth who provide the lower level of care, and we've received patients from the surrounding area and surrounding hospitals. As far as patients who strip our capacity to handle, we preferentially transfer those up to the University of Madison.
So with more patients being treated here, would you expect that UW Hospital up in Madison is treating fewer patients?
I don't have the exact numbers. I know that because we're a level 2, I know we absorb some of the volume below us, which was previously going in a different direction.
But again, I think time is of the essence. Probably so. Probably so, but if it's my body in the line or my wife's or my child's or your body or your wife, you'd want to get to the closest possible. Time is of the essence.
So the helicopter transports, either coming out of Rockford or Madison usually, right? That's not been a problem? You can call up a chopper and get them transferred to Mercy as opposed to them saying, no, they got to come to our hospital?
We have not had that problem yet, no.
So it's not so if the EMS people say we need a helicopter, they go to the nearest hospital that can provide the care needed.
We have had transfers in both from Madison's and Freighter's air flight services.
Does this also allow for growth of your staff as well as perhaps the campus itself?
I'm sorry.
Sorry?
Growth of the staff, mostly in the trauma center and other areas too?
Sure.
I mean, the trauma center and commitment that has gone to supporting the trauma center impacts the entire hospital, both in quality assurance and staffing and in technology. There isn't probably one part of this hospital I don't think that hasn't been impacted by the increase in resources, because they're obviously utilized not just for trauma, but for other patients as well.
How much pressure do you think you pulled off of, say, Madison or, say, the bank of hospitals in Rockford by being able to provide this service?
I wouldn't say that there's any pressure that we've pulled off of anyone. I think they're eminently capable of handling anything that comes to them. In fact, again, when our sources are outstripped, we will send patients up there. But what we provide is locally the resources to care emergently for the trauma patients, and most of them through their hospitalization and through their recovery. And again, being able to keep the families and loved ones in the area without having to travel far distances, which often they're not able to.
Speaking of differences, your map shows only Wisconsin. Can you tell me, are there level 1 and or 2 care centers in Rockford?
There's a
Yes, there's an American College Certified Level 2 center in Rockford.
Which one is that? Is that Rockford?
St. Anthony.
St. Anthony's.
Do you have plans for other improvements here?
Always.
We're on a continual improvement process.
Can you share any of those?
Mr. Bay?
Well, I don't know if we formally announced this or not, but we are going to be soon completing plans on a major expansion of our facility in Walworth, Wisconsin, between Lake Geneva and Delavan. We'll be adding a bed tower there and a large expansion of operating room services and other ancillary services as well. And so that's currently on the drawing board.
That's not a project underway, but it's something we're planning. Is that?
We're planning, yeah. We're just planning it. We've been just secured the financing for that, and so we're beginning serious planning right now.
When do you expect to build that?
Where's my facility guys? I like to always try, if you can pin them to a date, you'll be better than I can. Actually, we hope to go out for bid in April. And we'll have the first phase of that done, the bed tower, in August of 2011. Well, thank you very much. This concludes the question and answer, and after Dr. Rob Winnie is going to take us through something I think will be very interesting. That's a level 2 trauma activation on a recent trauma case. And after we go through that, we'll be around, and you can feel free to ask us questions on an informal basis as well, or individual interviews if you wish. Dr. Winnie?
Yes, if you could all follow us, we'll go through a trauma response.
Okay. Thank you.